Good afternoon and welcome to our deep dive that we are going to explore how states can reduce administrative burden and make it so that folks who are eligible for benefits are actually able to access them. I'm Cynthia Osborne, and I'm the director of the Prenatal to 3 Policy Impact Center at the University of Texas at Austin, the LBJ School of Public Affairs. And we're really thrilled that you are joining us today. Many of you joined us on October 7th for our Research to Policy Summit, in which we launched our second annual Prenatal to 3 State Policy Roadmap and demonstrated the great progress that so many states had made toward implementing effective policies to try to empower parents and ensure that children are born healthy and thrive from the start. And although we wish that we could have held that in person, we were virtual then. And so what we are doing is holding virtual workshops throughout the fall so that we can dive deeper into several of the aspects of the roadmap. We're really excited today to begin with what I consider one of the most important, simplest, and lowest hanging fruit when it comes to state level policy, which is creating policies at the state level that actually allow folks who are eligible for benefits to access them. And we're lucky to be joined by the two in the field who have literally written the book on administrative burden and how states conduct policy by other means. And both Pamela Hurd and Don Moynihan are going to be our key speakers today, and we're really excited to have them. I'm going to begin by just reviewing the roadmap briefly to provide the context of what it is that we're talking about with regard to strengthening the system of care for the prenatal to 3 period, why it matters and what we found that's effective, and how administrative burden fits into that. And then the kind of main speakers will take over and share what they have found with regard to how states are using administrative burden and how states can reduce administrative burden to allow families who are eligible for policies to access them. And we also invite you to share with us the questions that you have. If you can see in the chat, there are instructions on how to access the Q&A function, and we would love for you to submit your questions so that either I or our guest speakers will be able to address them. I'm going to begin by sharing information with regard to the roadmap. And just as a bit of background as to where this all begins, we know that the earliest years of a child's life are the foundational years that really set the stage for all subsequent health and well-being. That the prenatal to age 3 period of development is the most rapid and sensitive period of development, and that when children are exposed to safe and stable, nurturing, loving environments, that they are set on a trajectory toward long-term health and well-being. But that children who are exposed to chronic adversity, such as poverty or trauma or neglect, that these children will have bio and neurological potential damage that will actually have long-term consequences for their health and well-being. And unfortunately, there are millions of children in this country who do not have the opportunities that they deserve from the start. And we know that states are interested in finding ways to actually create these conditions in which children can thrive, and especially to create greater equity so that our children across race and ethnicity, across socioeconomic status, across geography, all have access to the opportunities that they deserve. And we've done a comprehensive review of what states are doing in order to promote better outcomes for children and families. And what we see is that state policy choices really do make a huge difference. That we also know that there isn't one policy or program or institution that can do it all to support families, that it really does take a system approach where we have broad-based economic and family supports and more targeted interventions that focus on the family, the caregiver, and the child directly. But right now, there really is a patchwork of programs and services and benefits across the states that children are exposed to myriad opportunities based on where they live, but also within a state, even when the policies are available to families, that they are often not able to access them. So given what we know about these earliest years and how important they are for children's development, we've identified these 8 prenatal to 3 policy goals that really set the stage or the conditions for children thriving from the start. And they are broad, such as making sure that parents can balance work and caring for their kids, that they have sufficient resources, that children are born healthy to healthy parents. Parents have the skills and resources that they need in order to be the parents that they strive to be and their children deserve. That when children are not with their parents, that they're in nurturing, caregiving environments, and that we can identify any delays that children are experiencing and address them as soon as possible to make sure to minimize the impact of those developmental delays and hopefully get children onto a healthier path. But the first goal that we have is access to needed services. And this is really essential. There are so many different services and programs and benefits available across the country, but we know that our families lack access to these, and it's disproportionately families of color or families of lower socioeconomic status who are not able to access what they're eligible for. Now, for each of the policy goals, we've identified a set of indicators or outcome measures that states can use to try to gauge how well they're doing toward making sure that these goals are actually being met for children and families within their states. And I'm just going to focus today on the first goal, the access to needed services. But what you can see is that there's wide variation across states in terms of this sort of access. In the roadmap, we focus specifically on access to SNAP, which, as many of you know, is one of the most important nutrition programs that we have in this country, or in fact, it is the most important. And it reduces food insecurity and improves the health and well-being of the recipients of that program. But in some states, more than a quarter of those who are eligible for that do not have access to it. But we can see that that is true across a range of different sorts of benefits, from health insurance to prenatal care to SNAP to developmental screenings, and the list will go on. So in response to these policy goals, what we did was to decide to create a roadmap for states to lay out what the most effective investments are that states can make to create those conditions in which children can thrive from the start, and that parents are empowered to be able to care for their children in the way that they want to. And our roadmap is based on some core principles. It's guided by that science of the developing child that is so clear as to what it is that children and families need. It's committed to identifying and looking at all of our policies through a lens of equity and making sure that we try to reduce those long-term persistent disparities in opportunities and outcomes, particularly across race and ethnic groups. And we're guided by the most rigorous evidence to date. We understand that there's a lot more that we need to learn, but we turn to the most rigorous causal evidence that exists and identify the 5 policies and 6 strategies that states can implement to create those conditions in which children thrive. And I welcome all of you to visit our website at pn3policy.org and to check out our new roadmap if you haven't already. You can look at the US version or any state that you are interested in. And each of the 11 policies and strategies that we've identified as effective have their own profile. So you can spend hours there at your leisure when you have that time. But I wanted to just discuss today mostly about our access to needed services goal. But this is our roadmap framework that outlines how each of these goals are impacted by the respective policies. So the 5 roadmap policies are expanding access to Medicaid, they're reducing administrative burden, and again, we paid attention to SNAP. There are paid family leave program of at least 6 weeks, a state minimum wage of at least $10 an hour, and a state earned income tax credit that's refundable and at least 10% of the federal EITC. And I'm not going to spend time today on our strategies. We will spend a lot of time on those in some of our subsequent deep dives, but those are more targeted interventions that states can implement. But I just wanted to highlight that kind of where states are in terms of just implementing these policies at all, and even if they're implemented, the range of services that are available and who has access to them still varies quite considerably. So when we look at Medicaid, administrative burden for SNAP, paid family leave, state minimum wage, or state earned income tax credit, you can see the states listed here who have adopted these policies at the threshold level that the research says is important and necessary in order to impact families. And what's very exciting is that this past year, 5 states moved from a no to a yes in at least one of these policies, and Missouri actually adopted 2. At the summit a couple of weeks ago, we spent a lot of time talking about the progress that states have made. But today, we want to talk more about what they can do with regard to implementation of the policies. So today is all about administrative burden, and in our roadmap, we focus, like I said, on SNAP. 1, because it is the most important nutrition program, but 2, it actually has a pretty strong evidence base as to what are the policy choices that states can make that lead to higher take-up rates of this. And what the current literature says is that a combination of policies are what states need to do in order to make it so that more folks who are eligible actually receive these benefits. That we need to make sure that the recertification interval is at least 12 months, that there's simplified reporting, which means that families only have to report a change in income if it would lead to a change in eligibility, and that families can access the services online, and that this combination of benefits is a key step in making sure that folks who are eligible have access to the program. In the roadmap, we go through and identify which states are in different kind of stages of this development. And there are 22 states who have all 3 of those components. And then there are states in various kind of stages of this policy development, if you will, that they will offer the 12-month recertification to some, or simplified reporting to some, or some online services. But it's really that combination of policies that make it so that families and states are better able to access this important policy. And this is the variation across states and the percent of eligible families with children under age 18 who are not receiving SNAP. So in all of these states, if these are families who are eligible for this benefit, but it's approximately $500 a month for a family at about 150% of the federal poverty level. That's a substantial benefit that goes toward food, and it's a dedicated sort of benefit that we know reduces food insecurity, and that we have so many families who are still not getting it, who are eligible. So I'm going to stop talking now and introduce my colleagues, Pam Hurd and Don Moynihan, who have written the book, literally, called Administrative Burden, Policymaking by Other Means, that will help us to better understand how it could be possible that we have all of these families who are actually eligible for benefits who are not able to receive them. and whether states are making intentional choices or unintentional choices, that the outcome is that we have families who have benefits available to them, that if we could get them attached to them, could it make a significant improvement in their lives. So both Pam and Don are at Georgetown University, McCourt School of Public Policy. And Pam Hurd is a professor with a background in sociology and an expert on inequality with regard to health, especially. She's also an expert when it comes to survey research and design, and has made a huge impact on this field with regard to helping us to understand the role that administrative burden plays in inequality. Prior to being at Georgetown, she was at the University of Wisconsin, and a little known fact that I don't think is on her resume anymore, but she was also at the LBJ school just before I got here. So our paths almost crossed then. Her colleague, Don Moynihan, and co-author, is the inaugural McCourt Chair at the McCourt School of Public Policy at Georgetown. He also was at La Follette just before and was the chair there at the University of Wisconsin at Madison. And he is an expert on helping us to better understand how governments work and how they could work more effectively. And if he has a huge Twitter following, and many of you may be following him already, but I highly recommend it because he keeps us abreast of what's going on in the world and how changes might make things a little bit better. So I'm going to stop now and hand it over. Pam is going to begin, and then Don. And again, please join me in welcoming them.
So thank you so much for having us. Donna's going to share the slides for me here, but I will get started. We're really happy to be here to talk with you all about the role of administrative burden in shaping access to a range of different programs. And I think what's important, I know we're talking a lot about state policymaking, is that in general, with states that are implementing a lot of these programs and have to figure out how to design these programs in ways so that people can access them effectively, because obviously we can't achieve the goals that we want to achieve with these policies if people can't access them. And so administrative burden, what we're trying to do basically is document and try to unpack the ways in which kind of onerous bureaucratic processes affect people's access to a range of different programs and benefits that the government offers. You can change the slide. This, to sort of start out in terms of thinking about how we think about this in a broader sense, this is a photo of Merrill Mayo. Her husband passed away on 9/11 in the Twin Towers. And we start the book with her in the sense that we talk about basically what happened to her after that and how she was, and her experiences trying to access government benefits. So, amid unimaginable grief, she found herself awash in paperwork, applying for everything from workers' compensation to private charitable support, life insurance. Merrill Mayo was also in this position, trying to figure out what she was eligible for, how to apply, what kind of documentation she needed. And she talks about this experience. She talks about being sort of one day kind of realizing, everything was scattered all over the place. And then I thought about all the things I had to do, all the laundry that was overflowing from the hamper. And I felt so overwhelmed, I just sat down on the floor and cried. But Merrill remembered one application process as being refreshingly simple. This was Social Security. All she had to do was make a phone call, fill out a simple form online, or if it were more convenient, she could have gotten help at one of more than 1,500 Social Security Administration offices around the country. And those first checks, the survivor checks that people receive for Social Security, were mailed out on October 3rd, 2001. So this is a simple example of how we want government to work. A public agency offered a helping hand at a moment when help was desperately needed. But all too often, people's experiences with government are the opposite, and they're characterized by confusion, delay, and frustration. And so we want to talk about this confusion and disruption in the context of kind of administrative burdens. So we're going to talk about what these burdens are, why they matter, and what we might do about them. So one of the reasons we wanted to basically write a book on this and research it more broadly is that we felt we really needed a language to talk about this. It wasn't that people weren't talking about these kind of bureaucratic hassles and delays and onerous processes, but we talked about them in wildly different ways, whether we were an economist, whether we were sociologists, or whether we were people on the ground actually implementing these programs. So we wanted to provide a language for people to actually talk about it. And this, hopefully this language would give us a way to ultimately address it, make it clear it was a problem, and then also to help us understand exactly how to address the problem. One thing we want to be clear about up front, right, is that these burdens aren't necessarily always bad, right? There's reasons why we have processes. We want to be sure that people, for example, eligible for these social welfare benefits are eligible for them. People who receive them are actually eligible for them. But one of the things that we talk about more broadly is that at the same time, we want to be clear about the benefits and costs that we're trading off, right? So if we have very onerous processes, we're pretty sure that only the people eligible for those benefits are getting them. And so we don't, for example, have high levels of fraud. But we also want to take into account all the people who are not getting access to those benefits. And one of the things that we find troubling is the extent to which a lot of government programs really focus on the former and not the latter. We can document quite well, actually, the degree to which those eligible, we can basically document, and we can document effectively fraud and abuse, overpayments, things like that. We don't do as good of a job documenting the degree to which people are not able to access programs. Broadly speaking, we want people to kind of think about and view their government experience as simple, accessible, and respectful. So writ large, this is a kind of normative goal we have with this research and with this concept. So what are these administrative burdens? So we tried to kind of break it down into sort of three buckets. So these are specifically learning costs, compliance costs, and psychological costs. So I'm going to describe a little bit what they are. So learning costs are the process of engaging in search processes to collect information about public services and how they're relevant to the individual. Generically, I'm going to talk here about actually some of the relief programs with COVID, but generically, right, this would be understanding that you might be eligible for SNAP, figuring out where you need to go to apply, what you need to do. I think one of the most complicated state-run programs is probably childcare assistance. And from talking to people on the ground and people who study the program, many people aren't even aware that there are programs that can help them with childcare assistance. So it's these learning costs. This is a slide this slide and the next one actually focus on access to COVID relief, specifically the automatic repayments, and then the subsequent slide focuses on the child tax credit. Now, interestingly enough, these are seemingly pretty simple programs, right? Effectively, what should have happened with both of these is that you just got a check, not a check, you got a direct deposit in your checking account. But for people who don't file taxes, both for the stimulus check and for the CTC, the child tax credit, they need to know actually that they're eligible for this program to receive both of those programs to receive those benefits, because they had to do special things to get them if you had not filed taxes. And so both in this case, this slide, what we see here is in California for the prior slide for COVID relief. Among low-income populations, basically only about 70 to 80% of people who were eligible for those benefits got them. And further research found, basically because people didn't realize that they could get those COVID relief checks. The next slide, please. This is in Michigan, a recent administrative data for the child tax credit. These are actually SNAP beneficiaries. And when they looked in that pool of SNAP beneficiaries, they were able to figure out basically as of August, about 30% of people eligible for them were not getting those benefits. Subsequent research basically showed that that was because they were unaware that they could receive these child tax credit benefits. So those are nice examples of learning costs. Compliance costs are basically the cost of following administrative rules and requirements. And this is what we typically think about when we think about kind of red tape, right? It's like all the paperwork I have to fill out. But broadly, we include things in this, like everything from fees that you might have to pay to apply for a program, to the time it takes to fill out the paperwork, to the SNAP interview that you have to do, to all the time involved. Those are writ large what we think about as compliance costs. So this is a picture of a little boy in Tennessee who had been receiving Medicaid benefits. He actually had cancer. But his family had low enough income to qualify for Medicaid. And basically what we found, or what happened to this little boy, Abul Sewell, is in the process of recertification, he lost his Medicaid coverage. His mom only found out about it because they showed up at the doctor's office and were told they no longer had Medicaid coverage. And the reason that they lost that coverage was because she had not filled out an 80-page form that she had gotten in the mail to renew her eligibility. In fact, what she discussed was she never got the form. Low-income populations move. I think many in the audience are aware of those complexities. And so in the end, what happened is basically the way that Tennessee did this was that if you didn't fill out that 80-page form and mail it back, or if you made mistakes on the form, they just canceled your coverage. What that meant was that over the course of about a year and a half, 220,000 children in Tennessee lost coverage. That's a really good example of kind of compliance costs in these programs. We also really take seriously psychological costs. So these are the kinds of the way that people feel basically when they encounter these kinds of administrative burdens in programs. So it's going to be everything from stigma, which we have often talked about, but it also includes things like loss of autonomy, stress. So what is it like when you're on food stamps and you lose those benefits and recertification because of an administrative error you make? Right? The amount of stress that can induce in people is actually quite high. You're looking at like basic needs not getting met because of administrative processes that we encounter. Next slide, please. So this is actually a quote from Stephanie Land. I don't know if anyone has watched Made on Netflix. I'd encourage you. It's a good overview of what navigating the social welfare system in the US can feel like to people. But what she talks about here is this overall process, especially people who are trying to navigate multiple programs, which frankly are people on SNAP, is how it just can make you feel like people are not trying to help you, that they're just trying to put up these barriers effectively. And we worry especially about poverty-based programs because it's not just in one program that people encounter them. They're not just encountering them in SNAP. The same person is encountering them in Medicaid when they're trying to access their child care benefit, when they're trying to access assistance for heating. Over and over and over again, these are the encounters that they have with government. And it begins to feel like they're not trying to be helped, but they're just trying to have blocks put in the way. There is, next slide, please. There is a little bit of research here on this generic topic. This is a project we've done recently that really actually tried to look very specifically at whether or not just in the process of like filling out a form. So we had people in a lab setting fill out forms for assistance that were real forms to try to figure out how variation and sort of simplifying or complicating that form led people, even in the moment, their physiological reactions. And basically what you see is even in the moment, people have in a lab setting, which is pretty artificial, people have real physiological reactions, underlying physiological stress reactions to these processes. So I'm going to now pass along to Don, who's going to talk about why these burdens matter.
Hi. So yeah, one sort of big takeaway from this project is the idea that little barriers might have big effects, that adding maybe a new documentation requirement or asking people to recertify their status more frequently might really have a larger effects than you might anticipate. Second, that these effects don't fall evenly on everyone, that they happen to probably have a bigger impact on people who already are struggling more in their interactions with government. And then third, that these effects have what political scientists call policy feedback effects. That is, they affect our views of government. And so they have the potential to create sort of negative experiences of government. And so just to the point about how these burdens have big effects, by one estimate, almost $200 billion worth of our time each year is spent filling out tax reporting forms. And those, much of the time, we're giving information to the IRS that it already has. And there's been some discussion about whether the IRS could actually simplify this process by not requiring us to provide that information. But whether or not you agree with that, the point is that the actual time involved that US taxpayers, in contrast to many other taxpayers, spend on completing these forms is really quite large. On the point of how burdens have what we call distributive effects or matter to inequality, there's a couple of reasons why that might be the case. The one is just differences in what economists might call human capital, but the sort of stock of skills and resources that people bring to the table every day as they just try to get through their lives. And these could include things like your level of education, your sort of persistence, but it could also include other things like the broader social network that you draw on. There's also financial resources that might benefit you, might, for example, enable you to hire a lawyer or an advocate in a situation where you might struggle with the administrative barriers. And so people who have lots of resources are in general going to be better able to overcome administrative burdens. Less advantaged groups might also face more burdens because, as Pam noted, they're more likely to just interact with them because they are more dependent on means-tested programs. But also there's another source of potential burden here, which is discretionary bias that bureaucrats might demonstrate towards marginalized groups. And so at the street level, you might have a greater potential for street level bureaucrats to favor groups that they feel some sympathy or association with and impose more burdens on groups that they disfavor. There's a screenshot there of a paper where we study this not in the context of the US, but in the context of Denmark, where we looked at how educational officials impose more barriers on applicants to schools that happen to have Muslim names. So we wanted to sort of start by presenting the various ways that burdens can arise. And I think Cynthia gave a very good overview of the potential of burdens to pose barriers in SNAP and just early childhood development programs more generally. But we wanted to finish on a sort of more positive note. And a large part of this project is starting with the assumption that if we acknowledge, measure, and identify burdens, we're going to be better able to reduce them when that is appropriate. And so now I'm going to talk about some practical solutions to that project of reducing burdens. I think a starting point is to recognize that burdens are things that are constructed. And by constructed, I mean they're not inherently found in nature. They reflect administrative and political choices that we've made over time about how programs should be designed and delivered to members of the public. One thing, as someone who studied public management all my career, that I'm sort of acutely aware of is that once a program is in place, we frequently don't go back and revisit some of those choices about design and implementation in the way that, for example, many private organizations are constantly looking at their processes to try and eke out some improvement in performance. One argument that we make in our book is that the preferences that political actors have about groups or policies will bleed into how they think about burdens. And so one way of thinking about this is that if you're a policymaker who generally opposes a particular program, but it still exists, one way you can make it less effective is to simply impose more and more red tape in the process of delivering that program so it gets to fewer and fewer people. And that as a policy option is somewhat attractive because burdens are not something that the media generally talks about or covers in a great deal of depth, right? So if someone adds a series of additional documentation requirements on a SNAP form, that's not going to be front page news or politically contested in the same way if one political party announced that they were going to reduce eligibility for SNAP. So what should governments do about burdens? At the conclusion of our book, we make the argument that at least since 1980, at the federal level, the government has required that anytime it imposes new regulations on private actors, that the benefits of those regulations be more than the costs. Right. And so you have to engage in some formal cost benefit analysis of any new regulation, and you have to be able to justify that those benefits are worth the time and effort of the regulation. And we're proposing something similar, perhaps less formal, but similar in the context of administrative burdens, because there really isn't something similar. We don't track the hassles or burdens in any systematic way that government imposes upon individuals. So that would be a starting point, that on some routine basis, government measures, identifies, and seeks to reduce burdens. That it also identifies the effects of burdens on particular subgroups. So whether burdens are affecting some groups more than others. Governments could also make attention to administrative burdens a standard in contracting with nonprofits or private actors. So frequently when government contracts with third parties to deliver public services, which it does a lot, it will generally specify two things in those contracts. One is that you have to hit a certain sort of financial target, and you may have some performance targets as well. But we don't specify that burdens have to be limited. And there are examples one can find in some situations where it might be profitable for a contractor to impose more burdens upon members of the public that will then help them to essentially cream skim those that it has to work with. There has actually been some encouraging progress on this in the last couple of years at various state levels, but also in the federal government. So I'm showing you a screenshot of a recent report to the president from the U.S. Office of Management and Budget, where they, and this report is public, where they basically said one of the goals of the Biden administration is to reduce inequities. And one means we think we can do that is to identify burdens in existing programs, and they provide essentially a checklist of questions for federal agencies to ask of the existing federal programs that are in place. And so that is sort of the philosophy that we're articulating here, that the governments just on a regular basis ask these types of questions about the programs that they have. In the sort of generic toolbox of solutions here that the OMB talks about, or many researchers have pursued, we might think about a couple of different types. One is an informational nudge. So, for example, you might text or send a letter to someone to tell them that they're aware, or to make sure that they're aware of a program they might be eligible for, or to remind them of an upcoming deadline to renew their status. And what we find is those informational nudges tend to work well when the problem is learning costs. And so when people are unaware of a program or of a potential deadline, that sort of nudge might really make a difference. On the other hand, when the problem is that there's simply a lot of compliance costs and it's extremely complicated to get through the process, then nudges don't really help. Telling people you're eligible for this program doesn't help if the person is still left dealing with a mountain of paperwork that they can't get through. And so there you need to look at other types of solutions like simplifying administrative processes, providing help to people, either directly through government or third parties. So people who will act as essentially navigators through the bureaucracy, help people complete forms, make the best choices, or use tools like auto enrollment. So the government looks at administrative data, identifies who might be eligible for a program, and sets the defaults to enrolling them in programs rather than putting the onus on the individual to enroll. It is sometimes easy to forget that the U.S. administrative state has done sort of really big things and positive things and designed programs incredibly well. And so we wanted to highlight one positive example here, which is Social Security. And sometimes today we sort of take Social Security for granted, but at the time it was created in the 1930s, it was this huge administrative project. At the time, journalists called it the biggest bookkeeping organization in the world. And in some cases, people doubted whether it could be pulled off. And what we see looking at the history of that time period was a lot of really deliberate choices about policy design and implementation that made the program a success. So, for example, one policy choice that people talked about was whether instead of having a Social Security number, people would have a stamp book. And every quarter, they would get a certain number of stamps from their employer that reflected their earnings. They would fill up their stamp book, and then over the course of their career, they would bring their many stamp books to the federal government, and they would get a Social Security benefit on that basis. And you can think about all of the ways that would have gone wrong. You know, people losing stamp books, black market for stamps, employers withholding stamps from employees. And so instead, Social Security came up with a technological innovation, which was the Social Security number, which allowed it to track the earnings of the individual across the life course, regardless of whether they moved from one state to another, and allowed the state to essentially shift burdens away from the individual and onto the government and the private employers. Social Security also worked incredibly well, partly because it built field offices across the country where it hired staff and trained them to think about the people it was serving as clients rather than claimants. And so the organizational culture of Social Security tended to be very sort of supportive of clients. So Social Security is sometimes described today as a simple program. You know, it's just government cutting checks. And that's not actually true when you look at the history of the program. It's an enormously complex administrative undertaking, but it feels simple to us as its users, partly because it's been so well designed. We're going to conclude with a couple of specific options here. One is really relevant to SNAP. So one of two solutions we're going to talk about. And here, this is an example of the state working with nonprofits. So we are working on a paper with some researchers at Code for America, which is a nonprofit that designs websites to help people get access to government benefits. And so it's starting to play a role in the child tax credit rollout in the last couple of months. They have designed Get CalFresh, which is a website that provides access to CalFresh, which is California's version of SNAP. One of the things we worked with them on was helping people understand the categories that they fell into. And so the background here is that if you're applying for SNAP in many states and you qualify as self-employed, you get essentially to claim a larger deduction and you get more resources. But a lot of people aren't really aware of the fact they might be self-employed or don't really understand what self-employed is as a category. And so what we did was work with them in designing a different website interface that gave people a little bit more information in sort of very understandable terms about what it means to be self-employed. And so we gave some examples like drives for Uber or DoorDash or has an online store. And what we found was that simple change in language and presentation of administrative categories that people found confusing had a fairly large effect, leading to about a 1/3 increase in people selecting the self-employment status category. And then we were able to observe that people actually did get these benefits and they passed the muster of the California administrative oversight of this program. So it seems to have worked pretty well. A second really specific example that we weren't involved in, but this comes from the use of the income direct driven repayment for educational loans. And so this is a program, if you've taken out government loans and you have relatively lower income, you can apply to have the loans pegged to a percentage of your income over time. And so for low-income earners, this tends to be a much better deal. But only about 1/4 of those who are eligible for the program have actually taken advantage of it. And this is a cohort of people who've gone to college, so they have high educational skills, and still a lot of them are essentially leaving this benefit on the table. One experiment to try and improve take-up looked at what would happen if, instead of waiting for people to seek out the benefit and complete the form online or via mail, you reached out to them and you sent them a form where all they had to do was sign it. So essentially they're getting an email being told, you're eligible for this program, it will save you money, just sign here and email us back the form. And you can see a massive increase in participation in this program. It goes to about 61% from about 24%. So that's the end of our discussion. We're really looking forward to hearing your thoughts on this. We're hoping that people take away from this the ideas that in any particular program, there are these different types of costs, and the trick is figuring out which of those costs matter the most and how they can be minimized in order to help people get access to the benefits that they would benefit from. Thank you.
Well, thank you both for your talk today. I really appreciate you sharing that information. And the book truly is excellent. We put a link to it in the chat for folks, and I highly recommend it if you haven't already read it. And I know I want to encourage more folks to put questions that they have in the Q&A, and Pam and Don are happy to address those. But I wanted to start with a question. I have a couple of questions that I'm hoping that you can both address in some way. So what would you say to state policymakers with regard to administrative burden? We've seen that this can be a real bipartisan issue when it comes to the fact that it can save expenses for the state. And but what is the message? Why should someone want to do this at a state level from kind of a practical standpoint, as well as the idea that you want more people who are eligible to receive a benefit? But why is it good for a state to do this?
So I can start. I think one background here is that for many years, policymakers heard from economists who might have offered a different perspective on administrative burdens, which is sometimes called the ordeals mechanism. And the logic of that perspective is that if you make benefits a little bit harder to get access to, only the people who truly need the benefits will do the things like fill out the forms, wait in line. And that intuitively, that sort of makes sense, right? If I see a long line and I value my time because I'm a higher income earner, I'll say, this isn't working for me, I'm going to skip that. But empirically, what we're increasingly seeing is that doesn't really tell the true story of how people respond to burdens. So it tends to be people who are experiencing scarcity, have lower resources to start with, might be in conditions of stress, might have lower education, who end up struggling more with these sorts of administrative barriers. And so one basic message for policymakers that I think they wouldn't necessarily be aware of is that when you're choosing to impose these sorts of barriers, you're not efficiently targeting the people who are most in need. Instead, you're creating a system that makes it harder for those who are most in need to get the help that policymakers have agreed they would provide to them. And so they're sort of reinforcing systems of unfairness that I think most policymakers wouldn't want to do.
Just sort of add, in terms of the one sort of bigger picture thing, I think in addition for state policymakers who are, who basically are proponents of expanding social welfare policies, for example, or, generically think these policies, like basically they want people to access these policies, right? Like I think generically one thing that's important for them to understand is that if people have negative encounters with government, if their experience of the unemployment system or their experience of SNAP is negative, there's a real risk there that people are going to be less supportive of future social welfare expansions. And so I think for at least what we would classify as, say, progressives, I think it's really important that people understand that while we absolutely want to be concerned about fraud because we don't want sort of negative perceptions of these programs, we do need to be just as concerned that people have positive interactions with the programs as well. And then just in a very kind of more practical view, programs like SNAP, for example, they're federally funded programs. I would sort of assume that it benefits the state on average, that more people who are eligible have access to those programs at the state level, that benefits the state as a whole, basically.
Right, and the spending would benefit the state in and of itself, not to mention healthier families. But can you speak to the trade-offs of the cost savings when you're preventing fraud, which I agree with you that there needs to be these reasonable protections put in place or administrative policies put in place to ensure that the folks who are eligible are the ones who are getting it. But it can be pretty costly. Can you speak at all to, what does it do to a state in terms of its efficiency if it extends its recertification interval, or it allows folks to recertify things online versus to come into an office visit? Have you done any research to kind of quantify what it can save states if they do reduce administrative burden?
I think we know generically across programs, or I don't think we do know generically across programs that intensive programs like TANF or SNAP cost more administratively to administer. They cost more. Their administrative costs are higher than are, for example, a program like Social Security retirement. They're not actually that different in terms of their underlying complexity, in terms of eligibility, benefit determinations, things like that. But the additional hurdles and barriers basically in a program like SNAP just makes it more costly to administer. So that is part of the trade-off, and one that I don't think policymakers really take into account, how much more expensive it can be administratively to administer burdensome programs.
Yeah, I recall a report by Brookings a couple of years back that estimated that programs like TANF, WIC, and SNAP, the administrative costs add up somewhere between 15% to, in the case of WIC, something close to almost 40% of the benefits that were provided to individuals. And so part of the goal here is to push us to think about what we mean by cost when we talk about cost. Like obviously, if someone engages in fraud, that's a very legitimate concern, and that's a cost to the taxpayer and the government. On the other hand, if you build a bureaucracy that consumes 20% of the benefits, that's another type of cost. Or if you create a structure where you've minimized fraud to very low amount, but lots of eligible people don't receive the benefits, then that is a different type of cost. And so I think, ultimately policymakers are the ones who are elected, and they get to make those difficult choices. We can't make those choices for them, but I think part of what the goal of the book is, and the discussion of this topic is that they be explicit and aware of what those trade-offs and what those costs are, rather than just focus really very much on one particular type of cost and ignore attention to other types of costs.
And I'd add generically, programs that, for example, heavily rely on shift the burden basically onto government tend to have less fraud, right? So a program like Social Security has very little fraud because they're keeping track of their earnings. You're not requiring people to come in, et cetera, et cetera. Indeed, when they designed the program, there had been some debate about whether to do like a booklet. You keep track of your earnings in a little booklet with stamps and so on and so forth. And one of the reasons they chose not to do that feels a bit like SNAP, actually, in terms of the kind of things that people have to collect. One of the reasons they chose not to do that was because they were like, well, it generates a lot of fraud. So sometimes when we make things less complicated for participants, we're actually making it less likely for there to be fraud too.
Yeah. Yeah, I really appreciate those trade-offs, not thinking about cost in just one way, and that the kind of unintended consequences that doing one thing may have to another. So there was a really great question that came in from someone in the audience, and I know that we don't have time to define the difference between block grants and open-ended entitlements and state funding and federal funding and all of those things, but it's a legitimate question. If everyone took advantage of all the benefits that they're eligible for, could we afford it? Are we relying on some level of wiggle room there? And then the second half of their question was, what happens to all the money that doesn't get spent if people are eligible and it's just sitting there? Where does all that money go? So I'll leave it to you guys to answer that, but I think it's a really fascinating question, and I'm not sure that everyone has calculated it completely, but it's a great question.
I was just, like the student just asked us in a class I was teaching, actually. And so I'll let Don follow up, but like one thing I would quickly say is like, partly this is super dependent on the program. So for example, rental relief right now, we do have billions of dollars in rental relief, COVID rental relief, just sitting there, like only 20% or something of it has been accessed, in part because the burdens are so high. So sometimes it's just sitting there. Sometimes for like entitlement programs, it's not sitting there. But obviously, yeah, we'd be paying a lot more out in a program like SNAP than we currently are. So it's a bit program dependent. And I just add, certainly state governments, when they have to absorb large fractions of entitlement programs, the costs of them, so something like unemployment insurance, for example, absolutely use burdens as a mechanism to control costs.
Yeah, and I think, from sort of a broader philosophical point of view, this gets back to the question of what can we afford? You have to take into account that these benefits are also a positive in some ways. So, if we give SNAP to more kids, we have pretty good evidence that you talked about, Cynthia, that will help make those kids healthier. They're not going to go to the hospitals as much. They're going to do better in school. They're going to earn more in the long run. And so from a broader perspective, are we thinking about these purely as costs, or are we thinking about these as investments? I think there's also, a very fair sort of mechanical budgeting question about what happens if, all the people who are eligible got the benefit, and then we probably would have a different conversation about how we prioritize. And so, do you want to live in a world where more people who are poor get access to needed benefits, fewer people like me get those benefits? I think that sounds good to me, right? But I don't think that's the conversation we're having now, where we just sort of assume that, well, the benefits are there, and if people really need them, they'll get them.
Yeah. And I know we're at time, but to just elaborate on that point, it's actually very easy for me to get the benefits I'm eligible for. I fill out my tax return and I get my mortgage deduction and my income tax, state tax deductions, and all of those things, and just a couple little dots that I have to, check marks. And so the question that is going to be left unanswered, but I know that you address it in your book, is the things that states can do to really promote equity in this space, because you have both spoken to how much it is that these burdens fall disproportionately on lower income folks, people of color. And so just kind of final word on this, if you have any recommendations for states as to the things that work to promote greater equity, and then we'll close out.
The problems, right, are disproportionately, as middle class people, as Cynthia was pointing out, it's relatively easy for us to access social welfare, like the benefits we're eligible for, like the tax credits, all that stuff. It's really, these are burdensome programs for low-income people. If I were to pick two things that you could change about programs targeted at poor people that would reduce burden, it would be getting rid of in-person interview requirements and minimizing any kind of asset documentation requirements. So even if you have to have asset as part of eligibility, the degree to which you can minimize anything people have to do to actually document assets, people who have no assets to begin with, those are the two, I think, evidence-based, the two things you can do to most minimize burdens for low-income populations.
Very quickly, I would say invest in data sharing. So using administrative data to shift burdens. There's frequently privacy concerns here, but finding ways to satisfy privacy concerns by using administrative data. This is something that the US state at the national and at the state level is not very good at relative to other countries, and there's a lot of potential room there.
Just to circle back to the example that you guys have been using over and again is Social Security. I'm sure if today we introduced the idea that a 9-digit number would be something that we would all know and memorize of ourselves, or I don't know the number, I think it's 9, and that everyone, would have that as a way to track us through all of our jobs and any benefit that we needed, we'd probably say that there are security issues that we were concerned with and may not do it. So we can find a way if this is our priority. So I know that we're at time, and I can't thank you both enough for taking time out of your very busy schedules and sharing with us today. And I know that this is such an important area that states are thinking about. They have the responsibility to implement a lot of federal policies. They think about how they can do their state policies more effectively. And it's these sorts of implementation measures that can really change the impact of these policies over time, in general. And so I encourage everyone again to read your book and to follow the work that you are both doing. And thank you again very much. And thank you for everyone who joined us today. And there will be 3 additional deep dive workshops, one that will focus on how we can use Medicaid to help to support some of the strategies that are in the roadmap, how our policy choices can lead to greater equity, and talking about how we can design paid family leave programs to meet your state's needs. So again, thank you for joining us, and thank you to Pam and Don as well. Have a great day.